Arwa Damon is the president and founder of the International Network for Aid, Relief and Assistance, a nonprofit that provides access to life-altering medical and mental health care to children affected by human-induced or natural disasters. And she joins me now live from Deir Balah in Gaza. Thank you so much for being with us on the program, Arwa. It's really good to see you. Now, I can imagine that you'll echo a lot of what Jonathan just told us, but we're, of course, focusing on the children that are enduring these extreme conditions. And this war has often been described as a war on children. Just walk us through some of your observations as you spend time there in Deir Balah assisting those most in need.
This is very much a war on children, and let's start with the reality that every single aspect of life that is intended to provide a pillar of stability for children has been completely and utterly eradicated. Home, eradicated. Access to education, eradicated. Access to school, eradicated. Safety, security, family, health, all of this has been eradicated. And when you drive around, you see children standing in line waiting for water, carrying these, gallons of water that are heavier than they themselves are. You see them running around without shoes next to open sewage. You see some of them, especially the younger ones, the babies, lying limp and listless in their mother's arms. We went on a distribution the other day, and we had walked into one of the camps where INARA works quite frequently doing activities for children, and they actually swarmed our team right away, thinking that, we had come on that particular day to play with them, to provide them with something of a distraction, because they have absolutely nothing. And this is not to mention the children that are in hospital. I was at the Al-Aqsa hospital a few days ago, and I met a little girl who's just 7 years old. She had bandages kind of in a marking all the way down her chest to her belly, because her abdomen had been sliced open. Her guts had spilled out onto the street. How doctors saved her is probably something close to a miracle. She was there in the care of her aunt, because her parents, both of them, were dead, and her aunt had not yet had the heart to tell her this. What you do also see, though, is this sort of sense of community and sense of love that is really sort of trying to wrap itself around the children. And also, when you're going around, you see a lot of children working, whether it's going through trash, whether it's trying to collect scraps, whether it's, trying to sell nuts or whatever it is that they can. I mean, the need here has grown exponentially since I last got into Gaza around 2 months ago. It's indescribable.
Right, and even if the bombs go silent, that doesn't mean the fatalities would necessarily end there, given the humanitarian catastrophe that you kind of highlighted for us there. What needs to be done immediately to prevent more damage from being done, especially to the minors there?
It's access of aid. I mean, so much of it really surrounds access of aid. And that's not just, Israel allowing more trucks of aid to come through, but it's also the facilitation of movement of aid within Gaza itself. When we look at the numbers of aid trucks that are coming in through Karam Abu Salim, or Karam Shalom as it's also known, you will see that more than 2/3 of those trucks are actually commercial trucks. So this means that that produce goes to the market where it is sold at fairly astronomical prices, and aid organizations don't have a say in terms of what trucks, what items should be given priority. And so, driving around yesterday, you see things on the market like strawberry and chocolate flavored milk, but you don't really see baby powder that was allowed in on a humanitarian truck that would have been distributed for free, permitted to enter. You don't see basic hygiene items. You don't see clothing. People need summer clothing. Even those who fled with, more than what was just on their backs, now they need summer clothing. Children need shoes. People need an ability to be able to stay hygienic. And this is the big problem when it comes to the spread of disease. You have open sewage running through these camps. You have people, 800 or more at times, that are having to share one toilet. And if we look at sort of the cumulative number of cases that were just released, you have more than 800,000 cases of acute respiratory infection. Mm-hmm. You have more than 500,000 cases of very watery diarrhea. The things that we take for granted, waking up in the morning, being able to easily wash your face, Your kid goes to play outside, comes back home. You want your child to wash their hands before they're going to, eat something or touch their face. Families here can't do that.
Right, and it's not just the physical damage that you're assisting with, it's the mental damage that has been done. And we know that this is going to linger on for years and years to come in these children's lives. What is the long-term impact going to look like?
If nothing is done, if this is not allowed to address it, you are quite literally going to end up with a generation that is incapable of developing into even a semi-functioning adult. Adults cannot cope with what is happening around them. Adults cannot grasp the depth and breadth of everything that has been lost. Children are unable to cope with it. Children are having to deal with not just the ongoing fear, but also witnessing their own parents' inability to protect them, witnessing their own parents' deaths. I met a girl who was injured. She had a severe shoulder injury, and she was about 13, 14 years old. She saw her brother bleed out to death in front of her. She's never going to recover from that. Look, children are not going to recover from what they have witnessed. We as people do not ever fully recover from this level of trauma. But what can be done and what absolutely needs to be done is for organizations to be able to establish sustainable, coherent, long-term programs to begin to ease those scars so that they do not become permanent blockages within a person's psyche. And we also have to remember that even though we do talk a lot about the physical damage, we talk about the lack of humanitarian assistance, the lack of hygiene, all of that also has a very deep psychological impact. Malnutrition has a psychological impact. Starvation has a psychological impact. Every single aspect of every single person's life throughout all of Gaza is creating a psychological trauma because nothing here is easy. Nothing here is accessible.
All right, the president and founder of INARA, Arwa Damon, thank you so much for your time. I appreciate it.